Taoiseach, last week, Prime Time did a special programme on Ireland's ambulance service. They monitored various counties across Ireland and also looked at ambulance response times in Dublin. The programme itself was shocking as they interviewed staff and family members who made 999 calls, some of whom received appalling responses. One son, for example, explained how he rang 999 as his father had chest pain. And even though they could actually see the Wexford Hospital from their own home, the ambulance took over 50 minutes to arrive, and unfortunately his father passed away. This man could not understand why ambulance control did not explain that there would be a delay, as he would have been able to drive his father to the hospital within a few minutes. When he queried this afterwards, he was told, people are not normally told that there will be delays unless they're asked. There was a whistleblower interviewed from the Midwest, and she said ambulance crews in the Midwest were run ragged and, quote, going without food for hours, unquote, trying to respond to patients because of a lack of ambulances. She's an emergency medical technician, and she said, and I quote, there are still not enough vehicles to cover an emergency. If a plane crashed, there are definitely not enough ambulances for it, unquote. She said the situation of late response times for ambulance call-outs in Limerick was serious. There wouldn't be a day, she said, that would go past that you wouldn't be stuck somewhere for an ambulance, going, quote, oh God, we've no ambulances to send there. The Health Information Quality Authority report, which was published last week, confirmed that ambulance calls continue to rise by about 10% per year, but also found, worryingly, that staffing levels in some control centres fell below the required safe levels. Now, Taoiseach, do you accept that ambulance response times are far from acceptable? And can I ask you what you intend to do to address this situation? And would you equally accept that it's time for a fundamental review of how the ambulance system in the country is organised to ensure proper and effective ambulance response times across the country, in all areas of the country, particularly in rural areas as well?
I think the ambulance service over the years has always been one where controversy has raised its head on many occasions. I recall being on the health board myself very many years ago, and the ambulance and the clapped out vehicles that were in many cases were a source of constant engagement at the meetings. Last year, since 2011 actually, there's been a pretty major programme of change underway to reconfigure the way that pre-hospital emergency care services are managed and delivered. Last year there were 280,776 calls, which was 14,000 more than in 2012. So that's pretty significant numbers, you can imagine, Deputy Martin. Now, there were no targets set at all for ambulance times in 2011. Minister Riley, when he was in charge, raised the bar for response times, and for 2014 a new target has been set for 80% of life-threatening calls to be responded to in under 19 minutes. The 2013 target was for between 68 and 70%. So actually, for the first time now, there is the hospital turnaround data is being collated on a national basis, which I think is important, and that will allow, an assessment of performance in the handover of critically ill patients in the system as a whole, in the response times, in the collection times, and that will allow, obviously, for determination as to how the system can be improved. It's not perfect by any means, I accept that. The HSE itself has acknowledged that at times, when high demand with the emergency care system, there is clearly a potential for delays in the transfer of patients from ambulance resources to emergency department, and this does result in delays in the release of ambulances from emergency departments and reduce the availability of ambulances elsewhere. And that's why a national coalition system is now being put in place. There's also been a whole new further set of details on the ambulance emergency department framework, And that clarifies the process of clinical handover, establishing where the lines of responsibility are. There's a 5.4 million increase in the ambulance budget for next year, which I think everybody will welcome. There will be 50 replacement ambulances next year, which I think everybody will welcome. And the DCTA and ECHO response times are actually improving, but the HICWA report recognises that patient outcome is actually more important than response times. So the clinical audit will begin next year, Deputy Martin, for the very first time. So I think it's an evolution to a point where you have national data being collated now, where you have increased investment in the sector, in the provision of new ambulances, and in the collation of that data. But most important of all is the health of the patient.
Thank you.
Teacher, you need to stop saying for the very first time this and that, because that's the classic political response to very serious issues. I mean, the HICWA report is quite clear that over a 10-year period there was very significant progress in terms of the training of emergency medical technicians, the whole pre-ambulance care council and so forth, which was established over 10 years ago and changed dramatically what was then happening prior to that. But the key point is, Taoiseach, that the lack of any strategic planning right now is evident, and something fundamentally has gone wrong in terms of the reconfiguration. I mean, what is the response to that person in Wexford who were within eyesight of the hospital, yet it took 50 minutes for the ambulance to get there? And I think there are probably deputies in all parts of the House who can instant cases where the response times were simply too long. Now, the money that's been allocated for replacement vehicles had to be allocated, because the HICWA report revealed that up to 50 or 47 vehicles were way beyond the 7 years and 500,000 miles, those are criteria for emergency ambulances in the state. They had long passed that criteria and still hadn't been replaced, and won't be until next year, which we welcome the fact now, but it was too late. And shows a lack of proactivity. So the bottom line, Taoiseach, is that the report says, and it backs up the prime time programme, that EMTs are not being adequately trained now, and also that there's a lack of strategic planning, and thirdly, quality assurance of clinical care is very, very limited. And it also criticises strongly the issue of the ambulance capacity being lost due to delay in handing over at the accident and emergency departments. So it's not a question of just saying it's far from perfect. There are serious issues there, Taoiseach, which are crying out to be addressed in terms of the reconfiguration and the move to centralisation. Something has gone wrong in terms of people's access to ambulances and the response times. Would you accept that?
I accept that it's not perfect, and that there are serious issues, and they are being addressed by the Minister. I think that you do accept, Deputy Martin, that a 5.4 million increase in the ambulance budget next year is important, and that's recognised by the Minister and is now in place. 50 replacement ambulances will be provided. These are brand new ambulances, obviously. I actually had the opportunity to deal with the private company in a number of new ambulances just quite recently. And they're absolutely, first class in the sense of the facilities that they have. And yes, I understand. Now, I think, well, let me say to you, the Minister Riley brought in the targets there for that the National Ambulance Service should be able to get to a case of a life-threatening condition, and that a patient carrying vehicle should be on the scene within 19 minutes for 80% of those calls. That doesn't actually deal with the problem. And I'll tell you why. Target times, Deputy, are only one element of an ambulance service, because at present, if an ambulance responds to a life-threatening call in under 19 minutes, and the patient unfortunately passes away, that's recorded as an ambulance actually meeting its target. On the other hand, if the ambulance responds to a life-threatening call in 20 minutes and the patient makes a full recovery, it's recorded as an ambulance missing its target. So the determination of the time doesn't give a comprehensive response of what it's one element of it, but it doesn't give an accurate response to it. The other thing I might say to you is that the emergency area medical service support was a 12-month pilot project between the NAS and the Air Corps, providing dedicated aeromedical support for NAS in the west, specifically where the roads were poor, land ambulance transit times were more severe. and a review of that project found that a clinical need actually exists for the service and recommended that it be established on a permanent basis. So the 2015 HSE plan actually includes a specific target for turnover at hospitals for the first time. So that's an improvement. And we also now have an ambulance important for the Midlands and for the West. So it's, as I say, it's not perfect, but it's the air ambulance for the Midlands and for the West is now in situ, and that's a big improvement in terms of access and travel times for hospitals.